New numbers from New York City show the coronavirus killing Black and Latino Americans at twice the rate of whites. These are preliminary stats. Mayor de Blasio says they don't include the hundreds who have died at home. But it's enough to paint a disturbing picture of racial disparity, especially when you look at New Orleans, Chicago, and other urban areas. With us tonight, Dr. Ebony Hilton, an associate professor of anesthesiology at the University of Virginia School of Medicine. She also happens to co-host the podcast, The B Word Unpacked. Doctor, thank you very much for coming on with us. And without any delay, please tell our audience what the 3 W's are.
Right. So the 3 W's classify what I call the healthcare privilege, which are white, wealthy, and wombless, which typically are men. Those 3 classes of people tend to have better outcomes across the board.
I talk about 3 other things, the unholy medical trinity that is responsible for so much of the underlying disease in the African American community. I've been kind of amazed at the number of people who seem to be hearing this week for the first time. Heart disease, hypertension, diabetes. Talk a little bit about that and this staggering death toll percentage among African Americans. I left out Detroit. We're, of course, seeing it there, too.
Right. I mean, for me, you can't talk about these health disparities as far as hypertension, diabetes, without speaking about the systemic racism that influences each one of those disease processes. You can't talk about obesity and diabetes without talking about food deserts that exist within the Black and brown communities. You can't talk about even chronic illnesses like asthma and chronic bronchitis without talking about environmental racism and the industries that are placed in certain zip codes and not others. And so there's a targeting of the Black and brown communities, as well as lower socioeconomic status communities, in which we tend to have these negative factors literally placed at our doorstep.
When Dr. Fauci says from the podium in the West Wing that this is an issue long after coronavirus is off our plates, long after it is an urgent risk to our health, this is what we've got to get to. And again, for all the people who haven't spent an hour or a day thinking about it, for all the people who are new to the term food desert, do you believe in America's ability to concentrate on this someday and really bring it down?
I think America has to. This health disparity in particular with COVID-19 is different than all the rest, right? When we're talking about infant and maternal mortality, we're burying our Black children at 2 times the rate of other races, or our Black mothers at 4 times the rate of other races. When that happens, it impacts only our community. It only impacts our family. But with COVID-19, when you're ignoring the entire population of Black and brown people, when you're ignoring the entire population of lower socioeconomic status people, then when those people who are the majority of the essential workers that are underappreciated, underpaid, when they are now infected, when they're not getting treatments, when they're not getting tested, and they go back home and infect their community, when those people also return to work, and when suburbia and the healthcare elite come in to get their food from Wegmans or Harris Teeter, or come to get their resources from these bulk retailers like Walmart and Target, when they come into that store, they're going to take that same virus that was allowed to fester within the Black and brown community, and they're going to take it home with them. So this pandemic, I think, will uncover the flaws of everything that feeds into the social determinants of health. It will have to be fixed, because now it will reach outside of the zip code of those vulnerable population to now impact the privileged.